Hi, I'm Tim Davis. I'm your school nurse, and today we're going to talk about the mandatory in-service every year on sugar diabetes. Now, sugar diabetes can come in two varieties. There's type 1, which was called juvenile diabetes, which is what we're going to talk about today, as that applies more likely to the students at the school. And then there's type 2, which occurs usually later in life, which is another subject altogether, which maybe some of you might be facing. However, because of the students, we're going to talk about type 1 diabetes today. So we're first going to discuss the normal blood glucose metabolism. Now, as you eat your food and digest your food, the food is turned into glucose, which comes down the bloodstream to each and every cell of your body, of which there are trillions of. And as the glucose reaches the cell, it can't get into the cell without a hormone which is produced by the pancreas called insulin. Now this insulin attaches to the receptor sites on the cell, and once that occurs, the doors open and the glucose is allowed into the cell, and there you have the cell with energy and nutrition to do its work. Now, in type 1 diabetes, the pancreas does not produce insulin. So, let's look at this situation without the insulin. Let's erase the insulin out of here. And what happens then? Well, the glucose comes downstream and builds up in the blood, but it can't go into the cells. And so, the cells the bloodstream continues to accumulate more and more glucose, and at the same time the cells have no glucose. So the cells are forced to get their nutrition from other sources, and they choose fat and they choose your muscle tissue to get their nutrition from. In that process, there is a toxin produced as a byproduct called ketones. And the ketones accumulate in the bloodstream. The ketones accumulate in the bloodstream, as well as acid accumulates there as well, and you develop a situation called ketoacidosis over a period of time, in the situation where the glucose builds up higher and higher in the circulatory system, and the cells are using fat and muscle for energy, producing the ketones, and acid developing over a period of time, ketoacidosis. In that situation, the breathing becomes rapid. It's called Kussmaul breathing. They may be lethargic. It's happening over a day or two, and they're getting worse and worse. They might develop abdominal pain. They could even go into a coma when it gets very severe, which is life-threatening. What can you, as a teacher or a bus driver or an assistant, do to correct this situation? Well, there's virtually nothing you can do. The situation has developed over a period of time, and it is a difficult situation in the hospital to do IV therapy, electrolyte therapy, insulin drip, and get them back over a couple of days, a few days, back to the normal balance between the glucose and the insulin again. So that is the ketoacidosis aspect of type 1 diabetes. It is a difficult situation to manage. There's virtually nothing you can do other than call for medical help if it develops into a situation that is maybe developing toward a coma, or at least is progressing so that the student is, or the young person is developing these signs and symptoms. Well, let's look at it from the other point of view now. Let's look at it where the insulin is on board. So the insulin is there. And where did the insulin come from if in type 1 diabetes you don't produce insulin? Well, there are a number of insulins that are available on the market to give to the diabetic. There's the rapid acting insulins. There's the short-acting regular insulins. There's the intermediate, the Lente and the NPH, and the long-acting Lantus. Now, these insulins sometimes are mixed together or they're used throughout the day. For example, Lantus is taken at night, but during meals, regular insulin is used to cover when the food is eaten and the carbohydrates or the blood glucose fluctuates. And so there's this array of insulins. There are even a few more insulins out there that are specific ones, but these are the ones that you'll usually encounter. Well, let's look back over at our picture here again, where we have insulin on board, and the receptor sites now are covered. So the glucose is going into the cells, but let's say that the insulin is taken and not enough food is eaten. So the glucose goes into the cells, which reduces the amount of glucose in the bloodstream now, and the brain, needing the glucose, begins to react to the fact that there's not enough glucose on board. And here we go for low blood sugar. The low blood sugar symptoms now are the student is going to be weak, maybe have a headache, he's going to be shaky, perhaps confusion, and the signs and symptoms occur rather rapidly. For example, they took their blood sugar before lunch, they gave themselves some regular insulin, and for some reason they didn't eat lunch. Now the regular insulin begins to work, the glucose is taken out of the bloodstream into the cells. Now the brain is missing the glucose, and so the symptoms develop rather rapidly, become weak, as though you missed your lunch, and you start to get headachy, shaky, confused. What can you do in this situation? There is something we can do. We can give sugar, either a candy or some glucose paste or some fruit juice or some carbohydrate that's rapid acting like a donut, something that has quick sugar in it will revive the low blood glucose situation quite quickly. There even is an injection you can give called glucagon that some students have in case they end up in a coma or they go unconscious because of the low blood sugar. And I should write that on here. Coma is on both of them is the last stage where they faint and go into a coma, and that can be reversed quite quickly by giving the sugar and getting that on board, and they pop right out of that coma quite quickly. Well, what is the most important way to determine whether the blood sugar is low or high is by the modern invention of a glucometer. The glucometer really is the bottom line of what the blood sugar is, and they're very simple to operate. You simply stick the slide into the glucometer, which turns it on automatically, and it's ready for action. A simple prick of the finger will elicit a drop of blood, and then the drop of blood is touched to the meter, and within a few seconds you will see the results, which are mine are 94 here, which is very normal, healthy blood sugar, and that will determine what the blood sugar is, whether it's high or low, without even really worrying about the signs and symptoms, because some of them may overlap and might be difficult to determine. So let's look again. With type 1 diabetes, the patient has no insulin of his own. The pancreas is not working, so he has to take an insulin from an outside source, one of these insulins, and there's insulin pumps as well. And there are two situations. You can have no insulin and there's too much blood sugar in the bloodstream, which develops into ketoacidosis, which is something you cannot correct, you cannot deal with. You have to send them to the medical professional to have that taken care of in the hospital. Or there's insulin and no blood sugar, which is low blood sugar, and that is something you can correct by giving sugar and bringing the student back to vitality by giving him just the blood sugar he needs to bring that back up to normal, and then hopefully he'll be responding to that quite quickly. So These are the signs and symptoms of type 1 diabetes. Don't forget that these young people are having to manage this very complicated situation on a daily basis, and sometimes the control gets a little they get out of control a little bit, and they may exhibit some of these signs and symptoms at times. And by knowing what to do in those situations, it will be a great help to all of us. So if there's any questions, if there's any situation you want to know more about, just come and see me. There's going to be a post test in your mailbox after today, which you can fill out and sign and put in the nursing mailbox. Thank you very much. Good day.